For 3 years, Petra Sundqvist was the emergency department's invisible woman. The nurse who took the overnight shifts nobody wanted, who restocked the supply carts without being asked, who absorbed the condescension of attending physicians the way old linoleum absorbs coffee spills, quietly, completely, without complaint. She was the one they called when a patient turned combative at 2 in the morning. She was the one handed the charting nobody else wanted to finish. And she was, without question, the last person anyone at Hôpital Sainte-Croix in Montréal expected a convoy of Canadian Armed Forces officers to walk through the front door looking for. Nobody looked closely at Petra. That was, in a way, exactly how she preferred it. She was 34, though the particular stillness behind her eyes made her seem older in the moments when she forgot to soften it. She wore her dark blonde hair pulled back so tight it looked almost punishing, and her scrubs were always a size too large, a habit, though nobody knew it, formed during years of wearing kit that was never quite fitted for women. The scar along her left forearm, she explained as a childhood bicycle accident whenever anyone noticed it, which was rarely. The one along her collarbone she never explained at all, because the collar of her scrubs covered it, and because she had learned a long time ago that the cleanest way to bury a past was simply to give it nothing to cling to. Her supervisor was a woman named Thérèse Cadore, charge nurse of the Sainte-Croix Emergency Department and the undisputed monarch of the triage desk. Cadore was 47, meticulous about hierarchy, and possessed of a particular talent for identifying whoever on her floor was competent and making their life considerably harder as a result. She had the instincts of someone who had climbed by making herself indispensable to people above her while ensuring those below her stayed exactly where they were. She wore her charge nurse lanyard like a diplomatic credential. Sundqvist. Cadoret's voice had a flat, administrative quality that she deployed to great effect across a crowded floor. She didn't look up from her tablet. The gentleman in Bay 7 has been asking for a warm blanket for 40 minutes. I need the crash cart in Trauma 2 checked before Dr. Archambault comes in, and whoever stocked the central line tray last used the wrong gauge. Sort that out before you do anything else. I'll take care of it, Petra said. She already had, in fact, identified the gauging error 40 minutes earlier and flagged it in the system. She had also already delivered a blanket to Bay 7. She had simply not mentioned it to Cadorette, because mentioning things to Cadorette had a way of resulting in 3 more tasks materializing before the first one was properly acknowledged. The physician in question, Dr. Félix Archambault, was the kind of doctor who had never once in his life worried about being in the wrong room. He was the head of emergency medicine, impeccably educated, enormously confident, and constitutionally incapable of entertaining the idea that a nurse might see something he had missed. He had twice spoken over Petra mid-sentence in front of patients. He had once, during a chaotic Friday night, loudly redirected her suggestion about a patient's arrhythmia with a dismissive wave, and the words, "Let's leave the cardiology to the cardiologists, shall we?" The patient had been transferred to the cardiac unit 2 hours later for exactly the condition Petra had identified. Archambault had not acknowledged this. He had moved on to the next case. That was the particular luxury of never being wrong. Nobody paid close enough attention to Petra to notice certain things. They did not notice that she never dropped anything, ever. Not a tray, not a syringe, not her composure when the monitors screamed. They did not notice that she could start an IV line on a collapsed vein in the dark, under pressure, in under 30 seconds, which was not a skill acquired in nursing school. They did not notice that when the department received a call about a multi-vehicle accident on the autoroute 40, Petra had already begun pulling resources before the triage coordinator had finished reading the notification aloud. They saw a quiet woman who worked hard and spoke little and never pushed for recognition. That last part was not an accident. Tucked inside a lockbox in the closet of her apartment in Rosemont, beneath a stack of books she had read 3 times each, sat a collection of objects that told a different story. A photograph of a surgical team somewhere in a place that looked nothing like Canada. The colors washed out by a different sun. A folded certificate she had stopped being able to look at directly. A small worn patch, a caduceus overlaid with a maple leaf, that had once been sewn onto the sleeve of a uniform she no longer owned, and a citation signed and embossed, commending Master Corporal Petra Sundqvist, medical technician, 1 Canadian Field Hospital, for actions taken on a specific date in a specific place that she referred to only when she referred to it at all as the Valley. She had gone off the grid 18 months after she was medically discharged. The shrapnel in her shoulder had healed well enough. The other things had taken longer, and she had decided that the best environment in which to rebuild herself was one where absolutely nobody knew who she had been. She had updated her civilian nursing credentials, applied to St. Croix under her original surname. Her mother's name, Sundqvist, not the name on the citation, and walked into the emergency department on a Tuesday morning, as if she were simply a nurse looking for steady work, which she was. Among other things, the night that changed everything arrived on a Wednesday in late February, which in Montréal means a particular quality of cold that is less a temperature than a commitment. It was 11:40 at night. The department was running on 3 nurses, 1 resident, and Dr. Archambault, who had retreated to the physician's lounge 40 minutes earlier to review files, which everyone understood to mean sleep on the narrow couch he kept in there. Caderet had left at 11, handing the floor to Petra with a list of instructions that amounted to do everything and document it for me. The call came through emergency dispatch at 11:52. Petra picked up the radio herself. St. Croix Emergency, Sundqvist. The paramedic's voice was controlled, in the way that people train themselves to sound controlled when the situation is anything but. We are 6 minutes out with a 41-year-old female. Snowplow versus pedestrian. Significant blunt thoracic trauma. Suspected tension pneumothorax. GCS of 8 and dropping. We have a large bore IV in. She's on high flow oxygen. Pressure is 70 palp. She is not going to hold. Petra did not feel fear exactly. What she felt was a sharp, familiar contraction. The same sensation she had felt 100 times in a different country, looking at a different patient, knowing that the next several minutes would determine everything, and that there was no one to defer to because she was the most qualified person present. It was a sensation she had spent 3 years trying to forget. It came back to her now with the ease of muscle memory. "Copy," she said. 5 minutes, maybe 4. We'll be ready. She set down the radio and turned to the floor. The resident on overnight was Dr. Theodore Plante, 27 years old, 3 months into his emergency medicine rotation, and at this moment visibly unprepared for what Petra's expression was telling him. He was a good person and a careful physician, and he was entirely out of his depth, which he knew. "What do we need?" he said. "Chest tube tray, thoracostomy kit, 2 large bore IVs drawn up. Get the ultrasound to Bay 1. I need O-negative cross-matched and I need Dr. Archambault on his feet right now. She was already moving toward Bay 1, pulling the crash cart into position. Page him. He's going to be. Page him, Plant. Plant paged him. Archambault appeared 3 minutes later, still straightening his collar, which meant Petra had already received the patient, assessed her, and correctly identified the clinical picture before he crossed the threshold of Bay 1. The paramedics had not been wrong. The woman, a night shift sanitation worker, named according to her ID as G. Tangway, 51 kilos, the kind of small that made injuries look enormous, was in catastrophic distress. Her neck veins were distended, her trachea had shifted. Her blood pressure, when Petra rechecked it, was 62 systolic and moving in the wrong direction. Tension pneumo. Petra said when Archambault walked in, left side. She needs immediate needle decompression followed by chest tube. We have maybe 3 minutes. Archambault looked at the patient, then at the ultrasound Petra had already positioned, then at Petra. His expression was the expression of a man running a calculation he found unwelcome. "Let's get imaging," he said. "We don't have time for imaging," Petra said. She said it quietly and without drama, the way she would have said it in the valley. "She will arrest before the portable gets here." Nurse Sundqvist. "I am the attending physician and I will make the clinical." The monitor made a sound that made Plant take a step backward. "She's going into PEA," Petra said. She already had the 14-gauge needle in her hand. "Dr. Archambault, I need your authorization or I need you to step back." Archambault stared at her. What happened in the next 4 seconds would be described differently by the 2 people who witnessed it. Plant would later say that Petra simply did not wait. Archambault would say he gave the instruction. The monitor recorded what it recorded. The chest X-ray they took afterward showed a perfectly placed needle decompression, followed by a textbook chest tube insertion, and it showed them in a woman whose blood pressure, 12 minutes later, had returned to a number that was compatible with being alive. Petra stepped back from the bedside. She stripped her gloves. She looked at Archambault. "She'll need the thoracic surgery team for the rib fractures," she said. "I've already placed the consult." Archambault looked at the patient. He looked at the monitor. He said nothing for a long moment. "Well done, Plant," he said finally, without looking at the resident. "Good instincts." Plant opened his mouth. Then he looked at Petra, and Petra gave him the smallest possible shake of her head. "Not yet." Plant closed his mouth. She did not need the credit. She never had. She needed the woman in Bay 1 to go home eventually, and that was already in motion. Over the next 6 days, Gabrielle Tangway, who turned out to be 53, not 51, the result of a wallet mix-up that was quintessentially Montréal, recovered in the thoracic surgery ward with the determination of a woman who had been shoveling Quebec winters for 20 years and was not about to be stopped by a snowplow. She had a daughter who brought her soup every day. She had a dog apparently waiting at home that her neighbors were watching. She had, it emerged, a son who was serving. The ward staff discovered this because the son called, twice daily, from wherever he was, which turned out to be a base in the Valcartier region. And then, on the 5th day of his mother's recovery, he stopped calling and started driving. Corporal Mathieu Sauvard arrived at Sainte-Croix on the evening of the 6th day with 4 members of his unit, all of them in uniform, all of them having driven through the remnants of a Laurentian snowstorm without apparent difficulty. He was 24, broad-shouldered in the way that suggests not gym memberships, but the kind of work that doesn't stop because the weather is bad, and he had his mother's particular quality of being completely unintimidated by rooms that expected him to be. He went to his mother first. That took an hour. Then he went to the nurse's station and asked, very politely, who had saved his mother's life. Kadoret was back by then, having resumed her position at the charge desk with the particular energy of someone reclaiming territory. She heard the question and stepped forward. "The care here at St. Croix is truly a team effort," Kadoret said, with the warmth of someone who had rehearsed this sentence. "Dr. Archambault leads our emergency team, and I oversee with respect," Savard said. He had a quality of attention that made the air in a room sharpen. "The paramedics told my mother she had about 4 minutes when she came in. I'm not asking about the team. I'm asking about the person who made that call." Kadoret blinked. "That would be Dr. Archambault, our head of. Mom said it was a nurse, small, blonde, quiet." Kadoret's expression shifted in a way that was not quite subtle enough for a man trained to read terrain. "Well, our nurses certainly support the physicians in." Savard turned. His gaze moved down the hallway. Petra was coming around the corner from the supply room, carrying a box of IV tubing, doing what she had always done, which was the work in front of her without commentary. Savard stopped. Something happened to his face. Not recognition exactly. More like the reordering of something he hadn't expected to find. "Who is that?" he said quietly. Kadoret followed his gaze. "That's Sundqvist. She's just one of our floor nurses, she." Savard had already started walking. The 4 soldiers behind him followed without being asked. Their boots were quiet on the linoleum in a way that only happened when people were trained to move without announcing themselves. Petra heard them anyway. She heard the particular rhythm of people walking in step, who were not trying to walk in step, which meant it was not affectation but reflex. She stopped. She turned. Savard stopped 2 meters in front of her. His 4 fellow soldiers fanned out behind him, not aggressive, just present, the way a unit moves when its member is doing something that matters. "You're the nurse who was on when they brought my mother in," he said. It was not a question. "I was on shift, yes," Petra said, carefully. Savard reached into the chest pocket of his jacket. He produced something, a unit patch. She registered it without meaning to, the particular emblem of a regiment she knew, and held it out to her. "One of the paramedics from the call has a brother in my unit. Word got around." He paused. "The medic who worked that call said whoever ran that resuscitation had the hands of someone who'd done it under fire." He looked at her steadily. "Have you?" The supply box was still in Petra's hands. The hallway was very quiet. She was aware, peripherally, that Kadoret had followed several steps behind Savard, and that Archambault had appeared at the edge of the corridor, and that Plante was hovering near the nursing station with the expression of someone hoping to be invisible. "I worked with the field hospital attached to 1 CFFSG, Petra said after a moment, "a while ago." Savard's expression didn't change dramatically. What happened was more internal, a small decisive shift, like someone confirming something they had already suspected. "Camp Mirage deployment? Kandahar rotation?" A pause. "Kandahar," she said. He nodded once. Then he drew himself up and saluted her. It was not the casual acknowledgement of someone offering a gesture. It was formal, textbook, the kind of salute that takes years to make look that precise. Behind him, his 4 soldiers came to attention and saluted as well, in the same synchronized silence. The box of IV tubing slid slightly in Petra's grip. Down the hall, Kadoret had stopped moving. Archambault had gone entirely still. Plant, who had been trying to be invisible, had become the opposite. Savard kept his hand raised. "My mother is alive because of what you did," he said. "The paramedic said it right. You ran that call like someone who's lost people and wasn't about to lose another one." He paused. "We don't let that go unacknowledged, not where I come from." Petra set the box down on the nearest surface. She straightened. For 3 years she had kept her shoulders rounded. It had not been entirely conscious. It was the posture of someone making themselves smaller than they were, a habit formed in the space between a life she had left and a self she was still reconstructing. But there was a specific muscle memory to standing at attention that the body does not entirely forget, and it surfaced, now without her choosing it. She did not return the salute. She was not in uniform, and the protocol was what it was. But she offered him a nod that carried the weight of everything she had not said. "At ease," she said, and the words came out with a register that had nothing to do with the hallway of a Montréal hospital. The 5 soldiers lowered their arms. Savard exhaled. "Were you at FOB Wilson?" 3 rotations, Petra said, 2011 through 2014. Something moved through the corridor. It was not visible exactly. It was the quality of silence that follows a name spoken aloud after a long time of not being spoken. "My sergeant told me about a medic at Wilson," Savard said quietly. "Said she ran a surgical bay in a collapsed tent during a contact. Said she kept 4 men stable for 6 hours until Casevac could get in." He looked at her. "He said she was the best combat medic he'd ever seen, and that she disappeared after her discharge and nobody could find her." Petra said nothing. "I think," Savard said, "that my sergeant is going to want to know where you are." It was at this point that Dr. Archambault decided to insert himself. He had been standing at the edge of the corridor long enough to have absorbed some of what was happening, and what he had absorbed had generated a particular anxiety, which in men of Archambault's type tends to manifest as authority. "Corporal," Archambault said, stepping forward, "I appreciate the sentiment here, but I think you should know that the resuscitation in question was directed by our attending physician. Nurse Sundqvist was assisting. I want to make sure credit is appropriately. The paramedic gave us a full report," Savard said. He did not raise his voice. He turned to look at Archambault with the uncomplicated directness of someone who has no use for social management. He said, "The doctor arrived after the decompression was completed." Archambault's jaw tightened. "That's a mischaracterization of Dr. Plant was there," Savard said. He looked at the resident. Plante had been waiting for this. It was visible on him. The particular posture of someone who has been holding a truth that had gotten heavy. He looked at Archambault. He looked at Cadoret. He looked at the soldiers. He looked at Petra. "I was there," Plante said. Dr. Archambault arrived after the chest tube was already placed. Petra, Nurse Sundqvist, identified the tension pneumothorax, called for decompression, and performed the procedure. I did not perform any intervention. I was trying to keep up. The corridor was very quiet. Cadoret's mouth opened. Then it closed. Archambault turned on Plant with the force of a man whose narrative has just been publicly contradicted. "Dr. Plant, you are a first-year resident, and I would caution you strongly before making statements that—" "He's telling the truth," Petra said. She said it simply, not aggressively. The way she would have stated a clinical finding, factual, clear, without embellishment. "And Dr. Archambault," she continued, "I have documentation of that night in the chart. I time-stamped my assessments because I was alone on the floor, which is a protocol I follow because it is not the first time attribution has been an issue here. Archambault looked at her. There was something working behind his eyes that was not anger exactly. It was the particular recalculation of a man realizing the ground has shifted in a way he had not tracked. Caderet, Archambault said, pivoting. I want this nurse's file reviewed. If she performed an invasive procedure outside her scope of— What is her scope? Sauvard asked. He asked it mildly, which made it worse. He looked at Archambault directly. What is the scope of a medic who completed the TCCC course, both levels of ATLS, and field surgical assistance training through the KIAF? He tilted his head. Because I can make some calls, if you'd like a clearer answer. Archambault said nothing. She saved my mother's life, Sauvard said. And from what I understand, she's been saving people in this department for 3 years while being handed the jobs nobody else wanted. He let that land. Where I come from, that gets recognized, not buried. He turned to Petra. Master Corporal Sundqvist, he said, and her old rank? Spoken aloud in this hallway, she'd spent 3 years making herself small in. Hit her somewhere she had not expected. My unit's medical officer is Lieutenant Colonel Beauchesne. He's been looking to fill a civilian advisory role in combat trauma training out of Valcartier. I'm going to tell him where to find you, with your permission. Petra looked at him for a moment. She looked at the box of IV tubing she had set down on the medication cart. She looked at the corridor she had mopped, the crash cart she had stocked, the bay where Gabrielle Tanguay had come in, not breathing, and would leave next week on her own 2 feet. She looked at Plant, who had told the truth when it would have been easier not to. Tell him, she said, that I'll think about it. It was not quite a yes, but it was the first time in 3 years she had said anything that was not a quiet no. Sauvard nodded. He reached out and, in the understated way of someone raised not to be demonstrative about important things, shook her hand, not the handshake of social convention. The kind that means something specific. Thank you, he said, for my mother, and for all the others you kept alive before anyone knew your name. He and his unit left the way they had arrived, quietly in step, without ceremony. Caderet had not moved from her spot near the nurse's station. When Petra picked up the IV tubing box and turned, Caderet was looking at her with an expression that had cycled through states and arrived somewhere that was not quite recognizable. Not embarrassment exactly. Something more uncomfortable than embarrassment. The particular sensation of realizing that the person you have been handing the worst tasks has been doing all of them and more, and that you had treated her availability as evidence of her insignificance. Sundqvist, Caderet said after a moment. I've got to get the supply room sorted before the next shift, Petra said pleasantly. Plant, can you cover Bay 3? Of course, Plant said. He looked at her with something that was openly admiring, and Petra found that less comfortable than the invisibility, though she suspected she would learn to carry it. Archambault had disappeared back in the direction of the physician's lounge, his peer review, which the hospital's quality assurance department would initiate 8 days later, following an anonymous chart review submission, and which would uncover a pattern of documented interventions by nursing staff correcting physician orders. Had not yet begun, but it would. 3 weeks later, the hospital's director of clinical operations called Petra into a meeting she had not been told the subject of. The director's name was Vandermeer, and she was the kind of administrator who had not reached her position by ignoring patterns. She had read the chart from the Tanguay resuscitation. She had read the timestamps. She had also, it emerged, received a letter from the office of Lieutenant Colonel Beauchesne at Valcartier, which was not the kind of correspondence a hospital director ignored. "I want to talk to you about the emergency department," Vandermeer said, "and about what you think it needs." Petra sat down. For the first time in 3 years at St. Croix, someone in that room was asking her a question they actually wanted the answer to. "Where would you like to start?" Petra said. She did not pick up a mop when she left that meeting. She walked back onto the floor, stood at the central desk, and began to make a list. Not of tasks assigned to her, of things that needed to change and the order in which they should happen, and who should be responsible for each. Plant watched her from across the station. "What are you doing?" he asked. "Starting," Petra said. The department, for the first time in a long time, was in the right hands.